All right. Hello, everybody. Let me start my timer. Welcome to December 22nd. I'll just say that. I am recording Contraindications Part 2, starting on page 241. Okay. So, we talked a lot about the difference between good and bad pain, challenge versus harm, risky poses, um, and essentially like an overview on contraindications and providing safe, effective classes for all students. So, as a reminder, we teach to the middle. We provide options, modifications for everyone, though, because we want to be welcoming, inclusive, accepting. We want to help everybody love and enjoy yoga in the way that's right for them. So, that being said, some common contraindications. There's a lot of these. Some of them are similar, so feel free to follow along in your book 241, or just take these and let them like sink in. So, first of all, deconditioned. So, students that maybe haven't necessarily done yoga recently, haven't been working out recently, this could be for any reason at all. It could be lifestyle, work, an injury, anything. So, essentially, this is going to be very similar for people who have come back from an injury as well. So not just deconditioned, because sometimes there's a difference. And then also similar for somebody that is still struggling with maybe an injury, especially like lower back pain, neck pain, and so forth. So essentially, as an umbrella for most people that have any of these injuries or conditions, we want to make sure to empower them, to move at their own pace. So, encouraging them to take their time, especially with transitions, that's really, really important. Making sure that they have the props that could help them. So, most of the time, that's going to be 2 yoga blocks and a strap. It could also be extra towels, a bolster, a pillow, extra blocks, and so forth. Um, Taking the time before class to talk to them and see how they're feeling in the moment and give them some ideas for modifications. So, for example, maybe suggest to them that when you're doing sun salutations, they do cows and cats or bird dog extensions. Remember, we talked about that recently. Bird dog extensions are so that's tabletop, opposite arm and leg extending, or just the leg and just the arm. It doesn't have to be at the same time. But that is an amazing option for anybody that's looking to build up strength and doesn't want to do the up and down. Um, so then finally, encouraging them also to take breaks when needed. Water, towel, just sit down, and so forth. We don't want people passing out because they're trying to keep up, hyperventilating, or anything like that. Okay, include other common contraindications, joint injuries. So obviously making sure that we're stacking the joints appropriately. And so if somebody has like a wrist issue, for example, they can turn their hand into a fist. They could also use weights or the hand grips. They can also skip those things and come down onto their forearms, or they can come to seated and so forth. For things that are like knee or hip joint issues or replacements, once again, if the knees are on the ground, probably need extra padding. So maybe it's a towel under each knee or a small black pad or a second yoga mat. That's totally acceptable. Whatever helps the student feel safe and supported during the class. Remember, we never want to force a knee or hip into or any body part into any position, but especially with figure 4, pigeon pose, and so forth. Remember, we talked about we used to think that we'd want in pigeon pose the shin parallel to the front of the mat. we've learned that we want it actually at a diagonal. So if you're bringing your right knee forward, your right foot's actually going to be kind of sitting towards your left hip, and it's at that diagonal. So that's really important as a reminder. And I like to have a caveat, little asterisk, that if anybody does come back from any type of knee or hip replacement or any type of surgery at all, that they are cleared by their doctor. Ask them that question. Literally, are you cleared by a doctor to be here? Okay, that's really, really important. Okay, so as a reminder for especially things like knee pain, crescent lunge, runner's lunge, all of those things, one, can be done with the back knee on the ground, or two, could be swapped out for warrior one pose. Warrior one is a great option, especially for people who have knee, back, or hip pain, because what are we doing? We're taking the balance out of it, we're bringing their base of support closer, and we're stabilizing their core. Okay, so that's a great option. And then finally, remembering, especially for things like hands on, if it is a knee or hip pain or joint issue, child's pose is probably not going to be the best time to give them hands on. You're going to want to look at giving them hands on, maybe laying on their belly or laying on their back and so forth, or standing in a mountain pose. That's a great time to provide someone hands on, because you're not going to be putting any pressure or weight onto their knees. But if you think about it, say they're doing child's pose and you press on their back, what are we doing? We're sending your weight and their weight into their knee joints. Not good. This is also the same, let's keep going, for foot, ankle, and plantar pain. So just making sure, like child's pose for someone who has had sprained ankles, for example, or any type of top of the foot bruise or anything like that, or even sometimes plantar fasciitis, it can cause severe discomfort and not in a good way. So maybe encouraging them to come to seated instead of child's pose, or to lay on their belly. And once again, no hands-on in that situation in child's pose. Okay, so going along, back pain and injuries. Honestly, back pain is super, super common. So what's the question we ask our students? Where on their back? Is it upper, mid, lower, or somewhere in between, or all of it? Does it radiate? Does it come and go, and so forth? Think about most people's lives nowadays. What are we doing? We're on computers, we're on devices, we're driving, we're sitting, we're wearing shoes that really aren't safe or effective for our feet, and that can translate into back pain. So just thinking about providing one similar to the deconditioned, lots of prop options, lots of modification options, and lots of breaks and taking their time. That's really, really important. But also remembering that anybody who's had like a herniated disc or back surgery or anything like that, clearing with them that they're good and able to do back bends. So camel, for example, is going to be safer for them than a up dog or like a wide cobra. A low cobra is a great option for people with back pain as well. But making sure that they come from their belly to table, then down dog, okay? And these are the things that you can talk to them about before you start your class. So obviously, if they get there right on time in any of these scenarios, just do your best. Try to give lots of cues and maybe check in on them throughout the class, especially if they're not using their props or they're going really, really hard. Make sure that you kind of go over and remind them that the props are there for them and just check in on how they're feeling. Okay. And then finally, knowing that also twisting so back bends and twisting can actually be extremely good for people with back pain, but it can also cause further inflammation, and it can even trigger more back pain. So encouraging them to ease into twists rather than maybe doing a closed twist that's really deep, doing a more open twist and keeping their torso a little bit more expansive rather than contracted. Continuing on, asthma. So we've talked a lot about asthma, honestly, and respiratory issues, and the fact that keeping your head above your heart is really important. So if you have anybody with any type of respiratory issue or asthma or anything like that, one, maybe encouraging them not to lay flat on their backs, but to put a bolster or a pillow or something behind them. And then also making sure that they know that they can take things at their own pace, especially if they are going to be doing like a vinyasa class or something like that, because um, deep breathing quickly can trigger an asthma attack or any type of respiratory issue. So that being said, if you have someone who has asthma or a respiratory issue, one, probably encourage them not to necessarily do Ujjayi pranayama unless they are ready and they feel good about it. And instead just encourage them to breathe on their own and to tell them to always focus on their breath during the practice. And exhaling as they come up is really, really crucial. So then remembering also that inversions and intense back bends, especially like a bridge, can lead to shortness of breath. So, like I said, keeping their head above their heart. So, having some type of block, bolster, something situation. You can even encourage them to stay seated rather than laying down and so forth. And obviously, if someone comes and has asthma and you tell them this and they say they're fine laying down, that's totally okay. Just let them know that there's options for them. Okay. Heart conditions, high and low blood pressure, hypertension. All of these are very, very similar. So, as a reminder, inversions can raise your blood pressure. Also, doing core on your back and doing back bends on your back. So, if you have a client who recently had a heart attack or a stroke or has higher or low blood pressure or hypertension, make sure that they know that they can do tabletop, camel, even belly back bends like locust or cobra and so forth. They can also do core work in table. It's honestly better for most people in general. And encouraging them to be really thoughtful of how they're feeling. If they start to feel dizzy or lightheaded, anybody, asthma, heart condition, any reason at all, they should sit down immediately. Okay? So making sure that we are also reminding anybody that has any of these conditions that deep breathing exercises might also trigger some of this, so that they can always just do their own breathing. They can always inhale and exhale through their nose, through their mouth, whatever feels right for them. Okay. Osteoporosis and osteopenia. So that's obviously bones that are brittle or not as strong. So yoga is really good for this. But we want to make sure that that people that have osteoporosis or osteopenia don't fall. So that's a big one. So you want to make sure that you're giving them props, maybe having them next to the wall, encouraging them to take their time transitioning from down dog to stand or from standing to down dog and so forth. Also making sure that they know things like making fists instead of putting pressure on their wrists, because most likely their wrists, I've seen a lot of people with this condition have wrist issues. So maybe showing them how to do forearms on blocks, for example, rather than hands down. Moving along. Dizziness, inner ear, anything like that. We want to make sure that if we're doing sun salutations, we give them options. So they could do warrior one instead. They could just stay in tabletop. They could do some seated stretching and so forth. But especially going up and down, up and down, up and down. And this is the same for vertigo. That's the next one. So vertigo, dizziness, inner ear, any of those issues, we want to make sure that we are encouraging them not to do this, but to stay steady. So that might be an option where you maybe take out some of your sun salutations if that person comes in late and tells you right away they have vertigo and you can't necessarily have that dialogue with them. You could just take some of that out, add in chair pose, add in standing mountain poses, and so forth. All right. Whew, frozen shoulder. So we talked about this. So Frozen shoulder, it's when essentially you're getting all these adhesions and it's going to be really, really tight. And essentially you need to move your body to break that up. So encourage people, first of all, make sure they have clearance. Maybe ask if they've done any physical therapy, ask what they've done for their own like yoga, exercising, and so forth recently, and then remind them things to limit things like time in downward dog, high plank, up dog, even tabletop can be a lot. And then maybe using a strap for things like the chest expansion, for binds, and so forth. And that they can always bring their hands to their heart. That's really important because holding your arms up is so tiring for most people, but especially if you have any type of shoulder pain or even neck pain, hands at the heart. Okay, carpal tunnel syndrome. So we talked about wrists and how complex and delicate they can be. So making sure you're reducing pressure in things like planks, down dog, arm balances, side plank, and so forth. Remembering side plank on your forearm, table on your forearms, and so forth is a great way to really incorporate all of the same exercises, the same poses, but in a safe way that is wrist friendly. Hernia and ulcers. So we want to make sure this is similar to cardiovascular issues. So if you're having any type of hernia or ulcer, first of all, they need to be cleared to take class. Second of all, they don't want to be doing things like core work on their back or any type of like deep breathing on their back. Really, they want to try to keep their head above their heart, and they want to be doing things more like tabletop. So they want to be doing things like bird dog, camel, not laying on their belly. That can be very, very uncomfortable for people that have hernia and ulcers. So definitely providing these options throughout class. Pelvic floor is very similar to hernia and ulcers in the sense that doing core work on their back so if you have tight pelvic floor issues, and which tends to be most of the issues with most students I've seen, doing core work on your back is actually going to exacerbate it and make it worse. So rather than having them do that, you can have them do things like bridges, heel taps on their back. So they would be laying, they lift their knees into table and they tap one heel down and then the other. And then making sure that they're not putting downward pressure. So if they're doing things like boat or plank, they'll want to modify. So in boat pose, they would have their hands behind them or hands on their thighs, or they'd skip it. And then plank, they just want to make sure that they're not letting their hips dip down. Hips in line with shoulders, my friends. And that's honestly best practice, best form anyways. All right, we're almost there. Wrapping it up. So menstruation, obviously, if you're having especially heavy blood flow, you can have similar symptoms to having dizziness and nausea, feeling very lightheaded, low energy. So reminding students to take it easy, to go at their own pace, and maybe to skip things that are up and down, and rather to modify. Like I said, Warrior One, tabletop, and so forth. Sciatica. As someone who has a lot of SI issues, I find, and research shows, that a lot of things like goddess pose, warrior two, skandasana, malasana can be really good and or really bad for sciatic pain. So remember, the sciatica goes all the way down and can radiate down your leg, and it goes right underneath the piriformis, which is like rectangular, onto your glute. So it's all in the glute, but it's obviously attached above and below. It's all connected. So we just want to make sure that anybody who has SI pain keeps their stance shorter. So for example, warrior two, goddess, and so forth, we still want to make sure our knees above ankles, but we don't want to go as far or as deep. That's really important. And then also making sure that they go slowly into things like pigeon pose, that they're not rushing into it, they're not dropping into poses. They're really easing their way in with their breath and with thoughtfulness and coming out of anything that hurts. And honestly, okay, I was gonna say this, but I'm gonna let me take one more. I'm gonna say one more, and then I'll give you my little final piece. So anybody with scoliosis, kyphosis, and lordosis. So we want to make sure that we are really aware of spinal movements. So both flexion and extension, things like forward fold, cobra, bow, and so forth. Um, we never want to force any part of the body, but especially the spine, into positions that do not feel safe or appropriate. So rather than doing necessarily like locus on your belly where you interlace your hands, maybe a student with any of these spinal abnormalities might want to do camel instead, or a low cobra, a sphinx pose, for example. You also can encourage them to not hold these poses as long. And as a reminder for everybody to continue breathing in these poses, the worst thing they can do is hold a pose and hold their breath and really stress their system and possibly cause like a trigger of low back pain, neck pain, or so forth. Also reminding students, especially that have any spinal conditions, to be careful and thoughtful of things like twisting. So especially like a crescent lunge twist, maybe with an exalt, or anything where they are rotating, so twisted chair pose and so forth, to maybe do an open twist rather than a closed twist. Okay, so that being said, that is pages 241 to 243. Flipping over to 244. Important takeaways, just in general for anatomy and pose safety. For your neck, remind students to lengthen their neck. They shouldn't be dropping their head for anybody, for any reason. They want to maintain a neutral spine so that we're not causing more or causing even worse neck pain or back pain. And then also remember to encourage students to never turn their head in poses like bridge, as this can aggravate the cervical spine. Important takeaways for shoulders. Remember, try not to incorporate too many planks, table, side planks, downward dogs at the beginning of classes. Or for long chunks of time. We probably only want to be doing maybe 2 to 3 minutes of plank series in a class, and that would probably be for like a vinyasa or a power or something. You don't want to be spending a ton of time relying on hands, wrists, elbows, shoulders. Even though in plank you're using your whole body, a lot of people, even people with good form, tend to dump their weight forward or drop their hips down. So just limiting this time in designing smart, effective classes where you're not hanging out in these positions for too long. Also be really thoughtful of using props and encouraging modifications for shoulder and chest openers. So using a towel or a strap between their hands or just skipping it entirely. Heart openers can be a lot for people's shoulders. So just remember to give lots of options. Excuse me. Hamstrings. Remember, most people across the world, in my opinion, at least in the Boston area, have really tight hamstrings, even if they can touch their toes. That doesn't necessarily mean that their hamstrings are loosey-goosey. I don't know anyone whose hamstrings are really loose and happy. Mine aren't. So that being said, we don't want to be holding stretches for too long, like down dog, forward folds, even child's pose. Even laying on your belly can get a lot on hamstrings and back. So making sure we're just not spending too much time in a pose. We've talked about it, and instead, other than yin yoga, we're looking at maximum 8 to 10 breaths in any given pose. And that's like a true maximum. maybe 5 to 6, okay? So especially in a forward fold, if I'm in your class and you have us in forward fold for like 10 breaths, I'm going to look at you. I'm going to give you the crazy eyes. Remind students to also, for both shoulders, wrists, elbows, all of that, back, knees, to always have a micro bend so that they're not hyperextending. I know Todd talked about the fact that in life we hyperextend, but in yoga, 98% of the time, we want to make sure that we're incorporating safety and making sure that we're not relying on the joints, on the ligaments, but rather relying on the muscles to hold us in poses like side angle, skandasana, triangle, and so forth. Standing split, all of those. So always having a little micro bend so that we're not hyperextending and causing pain. And then finally, also for anyone with issues with hamstrings, wrists, any of that, knees, using props, blocks, straps, towels, they are your friends, my everybody. So making sure that, for example, if a forward fold is too much for someone, they can have their hands on blocks. If knee pain occurs, they can put a towel underneath their knee while they're kneeling. They can also keep their knee lifted, put a block under their knee, so forth. There's so many options out there. Remember, you are a professional, my friends. You know so much, and I know all of you care so much, which is like, it's just incredible, and it's going to make all of you amazing yoga teachers, and it's really going to help all of these people that have any of these issues and conditions and backgrounds really feel safe, supportive, and really welcome in all of our classes, which is crucial. Remember, that's what we're talking about. Trust, trust, trust. Holding space, providing opportunity by being authentic and by being smart. Okay, so that is 244. So then finally wrapping up contraindications, 245 main takeaways. When you are creating your classes, my friends, always, always, always err on the side of safety and effectiveness. Ask yourself, why? Why are you teaching this? Why are you doing this transition? Why are you incorporating this pose, this breathing technique, and so forth? Why? What's the point? What are you hoping your students get out of it? What are you hoping they feel? How are you hoping they walk out of the room, and so forth? And when you're creating your classes, making sure that you think about these contraindications, these modifications and opportunities to help each and every student come to your class and leave feeling a little bit better, even, or a lot better. So making sure to empower your students to do what is right for them in the moment, to modify as needed, to take breaks as needed, to skip whatever they need to use props as needed, and to let go of their ego, to let go of comparison and judgment and expectations and all of that bullshit, okay? Yoga is about the present moment. It's about meeting ourselves on our mat where we are and honoring that opportunity, honoring that space, and really diving into it with an open heart and an open mind so that we can give ourselves what we need in the moment. And as the teacher, you are leading this. You are essentially shining a light on all of these options for people, for students, and that is so empowering. It's so inspiring. It's so motivating. So, as I said with the last contraindication video, every single student that comes into your class is an opportunity for you to connect, for you to provide, and for you to learn. And you are, remember, your first student. So always look at yourself as an opportunity to learn and to be inspired. So if you're having ankle pain, back pain, neck pain, wrist pain, any of that stuff, if you have scoliosis or asthma or anything at all, use it as an opportunity to learn, to grow, to evolve as a fitness professional, as a yoga teacher, my friends. Because honestly, if you look at every moment as an opportunity to learn, even after 1 month of teaching, even if you only meet 10 people during that month, you are going to learn so much. And that is going to help provide even more of a foundation so that in a year, 2 years, 10 years, you just keep building this foundation of knowledge, of experience, of options, of opportunities. Okay, I feel like I could talk about this forever. This has been 30 minutes though, and I feel like that just wraps up our contraindications other than pregnancy. We're going to come back for pregnancy. So this is contraindications part 2, pages 241. Let's see. 241 to 245. All right, y'all. So the word for this one is going to be jasmine. All right. Thanks, guys.